Hello and welcome to my reflection on motivational interviewing. My name is Nancy Murdoch. In all honesty, prior to this course, I really had not heard the term of motivational interviewing, and I did not have any understanding about how it could work and work with patients. During this course, I learned from Dr. Tillman, and with the use of Blackboard in the videos, information such as how to use the core skills, how to use open-ended questions, affirmations, reflections, and summaries to work with patients. I also learned about how the 4 processes of MI could be implemented, such as engaging, focusing, evoking, and planning with the patient. Learning about MI. So prior to intensive, I did a review of the instructional videos that were on Blackboard. Then I attended Dr. Tillman's presentation, which provided an in-depth outline on how MI could be used. I found it especially helpful to watch the videos that he had in his presentation, such as the effective and ineffective dentist. I also found it helpful to watch the video. I found it very entertaining, the backwards brain bicycle. That kind of hit home for me as a nurse of 32 years who has done triaging. I have definitely not used MI in my past. I've been very direct with patients, and I've had my own agenda when I am taking care of them, not an agenda trying to find out and use motivational interviewing with them. So it was very helpful to see that example of the backwards bicycle. I do believe I can train my brain to use motivational interviewing. Then we were able to use MI dyads, and I'm thankful for that time. We were paired with another student and scored and given feedback on how well we did or did not use the information and the techniques. This was very helpful. I realize I use open-ended questions very well, but there's some skills that I do not do as well. So it was helpful to see me do it and watch others in practice. I've been watching it in practice with my preceptor. I have been paired with a preceptor for my first clinical this semester who actually has been through this program. So I was thankful to be able to see motivational interviewing techniques as she does use those with her patients in most cases. And it's been kind of helpful to see how it can work. So what are the important take-home points that I have gained from MI? Number 1 is that I realized that listening is essential. It is probably my most difficult thing for me. I do have a difficult time with listening. As I'm talking to people, I often jump ahead in my thoughts to where I believe the conversation needs to go. Using MI, I realize that the conversation and important points need to be put in the patient's hand, not in my hand. So listening to the patient, truly listening, is essential. That is kind of difficult as I grew up in a very Hungarian New Yorker family where conversation is often chaotic and not necessarily focused on truly listening to others. So I did learn from this course that it is not my agenda, but the patient's agenda that we need to be looking at. And by listening to the patient's agenda, we are going to be more successful in outcomes. So I'm working more with how to have patients set their own goals so that they can be successful. So how will I use MI in practice on a scale of 1 to 10? I will probably use it 7 to 8. Rationale for not making it any higher is that I did occasionally try to use it with certain populations that I realize it may not be completely effective with. And those were patients that had Alzheimer's or dementia. The pediatric patient who is in a different learning developmental age and is a little more concrete, and patients who are post-stroke have a little bit more difficult time. I do believe components of it could be used, but I think it probably will be a little more difficult. So that's hence why I probably didn't rate it a perfect 10. Time constraints also may play into it. I was paired this semester with a PA student, and one of the pieces of information she kept telling me is, Nancy, you have 15 minutes to see this patient. She did not use motivational interviewing techniques, but rather had her own agenda. So it was a good learning experience, but I do think that it is important to really listen to your patients, and so that would probably be one of the, if I had a time constraint and I had to be seeing other patients. I'm hoping that wherever I do work, I will have the availability to have plenty of time to work with my patients. I do thank you for this opportunity with motivational interviewing. All of the slide information came from our Blackboard, or it came from Google Images. Thank you very much.